Welcome back to Power Play on this Thursday evening. Ontario's government has unveiled its full health care plan now. It includes $30 million to create up to 18 new primary care teams and a reiteration, really, of the province's intent to use private clinics to clear a massive surgical backlog. The premiers are all set to meet the Prime Minister Tuesday to talk about a long-term health care deal. I spoke to Ontario's Health Minister and Deputy Premier Sylvia Jones about that earlier today. Hi, Minister. Good to have you back on the program.
Nice to be here. Thank you, Vassy.
I know you released many additional details of your health plan today. I wanted to start off by asking about it in the context of the big meeting that's happening here in Ottawa next week, and in particular, what Ontario is looking for from Ottawa. I spoke with BC's Premier, David Eby, this week, who indicated to me that the money the federal government brings to the table is not necessarily a red line for him or BC. Is your position similar?
Well, I'm going to let Premier Ford do the leadership at the conference next week, but I can tell you that, a message that has been resonating with us in Ontario is since 2018, we have invested $14 billion additionally in our healthcare spending. So we're there. We just want a willing partner. Right now, as you know, federal government gives 22%, and we would like to see that increase to 35%. It's nowhere near the 50-50 partnership that many Canadians believe is currently in place. 22% is what the federal government is currently providing Ontario residents.
When you look at increasing that share, are you looking specifically to the escalator for the Canada Health Transfer? And if I could ask you bluntly, would you like to see that escalator increase?
Well, I think it's important that we don't have a situation where we have an immediate influx of money and then we end up bleeding back again. So absolutely, right now, 22%, we need to make sure that the investments are ongoing, because once we make those commitments to hire new primary care physicians, to hire new nurses, to build new medical schools and hospitals, we want a partner who's going to be there not for the short term, but for the long term, as we have committed.
I know that you referenced a number, I think it was $14 billion, and I think you said since 2018. I'm going to put to you some other statistics that I gathered from the Financial Accountability Office of Ontario, where they indicated in the last year they were able to calculate for 2020-2021 that Ontario actually had the lowest health spending per capita in the entire country. Is it fair for you to expect the federal government to invest more when you spend less per capita than any other province?
Well, what we are doing in Ontario, again, I will say $14 billion since 2018 has been added to the Ontario health budget. And that, I must say, is outside of COVID spending. So we're making the investments. We just want a willing partner and a federal partner who's willing to be there and help us with those investments. Brand new medical schools, 2 of them in the Greater Toronto area, expansions in residency positions for new physicians who want to practice in Ontario, 50 different capital builds for new, renovated, or expanded hospitals across Ontario. Again, I will say we are making the investments. We just want a partner to be there with us.
But when you say you're making the investments, perhaps relative to investments that you had made prior, however, relative to the rest of Canada, it's still lower. I think on average, it's 10% lower per capita, the health spending in Ontario, than other provinces. Are you prepared, if the fiscal situation, for example, is worse in the next few years, to continue investing and increase, actually, rather, the level of investment in health?
Well, as the Premier has always said, we will always be there to invest in health. We know that we have an aging population, an increasing population in Ontario, which is why we're making those investments now, so that for generations to come, we have the infrastructure, the healthcare professionals, the clinicians able to serve that aging and expanded population. So yes, absolutely, we will continue to invest in Ontario's healthcare system.
But will you increase it if your revenues decrease, is my question, because in the past your government has made decisions to invest less in other areas because revenue had decreased and you were worried about the fiscal situation. Is that something that your government would do again, or will you avoid that because of the crisis the healthcare system faces?
So again, I will say our history has shown that the investments are there. $14 billion since 2018 added to our healthcare budget. And we will continue to make those investments. We've made those commitments to our hospital partners, to our colleges and universities, expanding positions and available spaces for people to train and ultimately work in Ontario.
And I do, Minister, take your point on the whole number. My challenge to you was just around when you divide that by the number of people in Ontario, the number isn't quite as big as you're presenting it. I do want to move on, though, to the fact that Jagmeet Singh, the leader of the NDP here, is specifically singling out Ontario. And the last time we spoke, actually, the announcement that you had made around increasing the number of privately delivered procedures in order to clear the surgical backlog. He says that the federal government should hold back money from a province like Ontario for expanding the private sector's role in healthcare. Have you had any insinuation or warning from the federal government that that is even on the table?
None whatsoever. And in fact, Prime Minister Trudeau has said that he embraces innovation and is looking forward to seeing how Ontario is doing it. But I want to reinforce, this is not unique to Ontario. We have community surgical centers and diagnostic centers in British Columbia, in Saskatchewan, in Alberta. So for Jagmeet Singh to suggest that in some way there should be a clawback for territories and provinces that do it, I would respectfully say that he needs to understand the current system better.
And certainly when I've interviewed him, I have pointed out that other provinces do endeavor to do the same thing, and you're not wrong there. His contention is, well, other provinces like, let's say, BC, which do it, are backing away from it, while Ontario is expanding the role of the private sector right now. And his concern, as he's outlined it to me and here on Parliament Hill, is that already the province faces a staffing shortage in the public system. And this boost to the private system will lure those few staff away from the public system towards the private system, and the public system will be sort of at a loss. How do you respond to that?
Well, in fact, I would point to the fact that our cataract expansion announcement in Ottawa, in Kitchener-Waterloo, and in Windsor were all within existing infrastructure and using existing health human resources. So again, we've looked at where capacity is available, where wait times are frankly too long, and said, if you can do more, if you can do additional procedures, cataract surgeries, then we want to empower you to do that, which is exactly what we did in those 3 communities that have people waiting too long for cataract surgeries.
But that's not just what you intend to do, right? There's knee, there's hip, there's other procedures. And the idea that staff will go towards those clinics where they can make more. Like, what are you going to do to prevent that from happening?
What we are doing is, through the process of applications, we are asking how and where are your health human resources coming from. We understand that there will be applications from not-for-profit, from hospitals, and from for-profit. So the combination will be, as part of the application, show us how you can appropriately ensure that when we give you a license, you are going to be able to serve the community faster. Because at the end of the day, this is all about people are waiting too long for surgeries that are impacting their quality of life, their ability to engage in community, in work life, in with their family. We need to decrease the wait list.
And no disagreement from me or the people watching on the wait list aspect of that. But if, for example, you get an application that says, well, everyone who's going to come work here used to work in a hospital, like, are you going to deny them the license to do that?
So part of the application process will be an assessment and a review of where the HHR is coming from. But I want to reinforce, this is one piece of a puzzle that we have also expanded, the ability for nurses or individuals who want to train as nurses, a learn and stay program where the Ontario government is paying for tuition and books so that those individuals can practice within their communities.
But that still doesn't tell me black and white that if a private clinic decides to pilfer all the nurses from a public hospital, that they won't be given a license under your government. Sure, you'll examine it, but you're not drawing any hard lines, right?
So there will be some legislation coming forward that will clarify and further explain how the application process will happen. But again, I will say capacity is happening within our hospital system.
Thank you very much for your time, Minister.
Stay well.
You too.